Perth Children's Hospital is a $1.2 billion state-of-the-art facility, promising world-class care to Western Australia's children and families. But what happened in the emergency room at this hospital on the Easter long weekend has prompted outrage and despair.
Since that incident, I've been telling everyone, Perth Children's Hospital is a 5-star hospital with a 0-star care.
We should not be tolerating a 2-hour wait in our emergency departments for anything, really, to be honest.
Hello, my name is Australia and this is Channel 9 News. First of all, let's check the weather forecast for tomorrow.
My daughter was always happy. She was so ambitious. She wanted to achieve a lot of things in her life.
She was very talented, always happy and caring.
7-year-old Aishwarya Ashwath was rushed to PCH on Easter Saturday after coming down with a fever that her parents noticed was getting worse. At about 5:30 p.m, Aishwarya's father carried her into the emergency department, telling staff she was unwell.
They were very casual. They were not taking it serious.
An internal hospital report later revealed a cascade of missed opportunities which may have contributed to her death. Aishwarya was assessed in the second least urgent category. For nearly 2 hours, her parents say they pleaded at least 5 times with multiple staff to attend to her, saying her eyes had turned cloudy and hands were cold.
We were just looking for help. We were looking for help in an emergency department.
According to the report, Aishwarya's temperature was recorded at 38.8 degrees with a heart rate of 150 beats a minute. Around an hour and a half after arriving at the ED, a hospital staffer noticed Aishwarya's head was lolling back and her limbs looked very limp.
My child was dying in front of them and they were doing nothing.
After 7 p.m, she was seen by a doctor, but her condition deteriorated. She went into cardiac arrest and died after 9 p.m. The report found Aishwarya had a Group A streptococcus or sepsis infection.
This shouldn't have happened.
If any of those showed a little bit of mercy to us, our child would be with us now.
A little bit of a compassion. We don't expect them to be a superhuman. Just do your job.
The report revealed staff had raised concerns with hospital executives about workforce shortages and increasing patient numbers since October last year. On the night Aishwarya died, 3 resident medical officers in the emergency department had called in sick and none were replaced because of a lack of available staff.
Do you maintain that staffing levels were not a factor?
Look, I do on that particular incident. So to quote the report, the fact that the parents communicated to various staff their concerns with various responses shows that staff were available to attend to this patient. Now, but I want to stress, staffing is an issue in the hospital and all our hospitals.
Whenever your frontline clinicians who are there on the coalface, experiencing what every day is like 24/7, are telling you that their waiting rooms are dangerous and that they need to do something about it. If you don't take action on that, that is very serious.
There have been widespread concerns about understaffing, treatment delays and record ambulance ramping across Perth's hospitals. Dr Peter Alali is the WA Faculty Chair of the Australasian College for Emergency Medicine. He doesn't work at the Perth Children's Hospital.
People are staying in emergency departments for many, many hours after their emergency treatment is finished. That is causing that is a phenomenon called access block. We've got a system that's got minimal or no surge capacity.
The hospital is yet to officially accept the report's findings, saying more inquiries are needed. The CEO declined an interview with 7:30 but said there is a commitment to making immediate changes to prevent this from ever happening again. Pressure has been mounting on Health Minister Roger Cook too. He also declined an interview but said strategies are being implemented across the entire health system, including 16 more nurses at Perth Children's Hospital.
Who needs to be held accountable? I would say everyone involved in the incident, directly or indirectly, should be held responsible.
Aishwarya's parents question the accuracy of the hospital's internal report and will be giving evidence to an independent inquiry. They are planning on filing a complaint with the hospital regulator APRA in coming days.
We would have grave concerns that it's easy to scapegoat individuals who are working in a broken system. We need to support people. We need to support our staff members who are desperately trying to help people in a system that is broken. We need to not blame them. We need to fix the system.
We all have jobs. We all work under pressure. But that doesn't mean we keep making mistakes. And if that mistakes leads to death of someone, that is not acceptable.
She liked princesses, yeah. She wanted to dress like princesses. Yeah, she was a girly type.
Aishwarya's parents are working on a new policy to allow parents to escalate concerns in WA's hospitals. They don't want other families to experience their pain.
Nobody should go through this. They have destroyed our happiness, our life. We'll have to live in this pain for the rest of our life.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.